An old drug, remdesivir, is showing new promise as a possible defense against the coronavirus. And St. Michael's Hospital in Newark is one of just a handful around the world testing the treatment on critically ill COVID-19 patients and those on ventilators. The hospital has a long history of groundbreaking research in the fight against HIV. While it is promising, it's not yet sanctioned by the CDC or the FDA. Michael Hill reports.
It seems like a race against time for doctors treating the more serious cases of COVID-19 and labs researching what potentially will help patients recover and go home. A federal panel of infectious disease experts said there was not enough evidence to recommend for or against the drug remdesivir for coronavirus treatment. But that could change based on its use and results. Christ Hospital's chief medical officer told NJTV News 2 weeks ago about a 21-week pregnant woman.
We actually got approval for this compassionate care medication called remdesivir. And Gilead gave the medication to us rapidly, and the next day we got her off the ventilators.
The FDA has approved wide use of remdesivir for trial. St. Michael's in Newark is among 68 hospitals across the globe in a clinical trial that began this month. It's given remdesivir to 16 severely infected adult patients.
So what we're seeing right now is mixed results.
St. Michael's chief medical officer, Dr. Hāmid Shaaban, says remdesivir has helped 6 patients. 5 remain on ventilators and 5 died, likely because they were too sick. Dr. Shaaban finds remdesivir can be very effective if used early on.
They present with moderate to severe illness, which depends on how short of breath they are, the oxygenation levels. I think that is the perfect window. That is the perfect time where remdesivir would be of benefit.
Because what exactly does it do to the body, to the immune system? To do what? How does it help a human?
So what remdesivir does is that it inhibits the RNA polymerase. That's the enzyme that helps in viral replication. That's what increases the viral load, increases the number of viruses in the system. That's what. So if you are able to decrease the viral load, the likelihood of having a severe infection also decreases. The likelihood of getting this severe inflammation that ultimately kills also decreases. So it's very important to decrease the viral load with agents such as remdesivir.
The government-approved expanded access of remdesivir is a step up from compassionate use for one person.
I mean, I think the message is that, Gilead and the Food and Drug Administration understands that this is a pandemic. Even though we don't have any medications that are tested, proven in humans, that we've seen the data in vitro, and that we think that this is probably one of the best opportunities to help individuals. We don't know if it's going to work, but I think they've taken it seriously and made this drug available to everybody around the country and around the world.
The federal panel of infectious disease experts also said there was not enough evidence to recommend for or against the use of a combination of hydroxychloroquine and azithromycin, as the White House has touted for weeks. Dr. Shaaban says families have asked about the combo for loved ones.
It's very difficult to explain the clinical basis of the decision that we're making. But yes, it has made it very difficult.
For now, Dr. Shaaban and hundreds of others are pursuing the benefits of remdesivir and other remedies to create more scenes of recovered patients going home. Michael Hill, NJTV News.